Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Hardeep Phull. Thanks for joining us today, Hardeep.
Thank you, Kim. So happy to meet with you again in person or virtually,
Yeah,
face to face.
exactly. Again, we've been waiting for this.
Yes.
So, in sharing how we met, I started the new year off right by making some wonderful connections, and one of which was you.
Likewise, I was so glad to connect with you and love the work that you're doing to empower doctors and everyone. I mean, honestly, everyone wins when everyone is empowered and their contributions matter. So love what you're doing.
Well, thank you. I appreciate that. And as we'll find out, you're doing a lot of wonderful things yourself. And after we initially connected, we had a phone chat a couple weeks later, and then I connected you with some of my doctor friends.
Hmm.
And then now here we are.
It's wonderful. I mean, look how connected we are. We're one connection away from so much. And I always talk about force amplification. And it's not just the number of people, it's the quality of people who are on the same journey with you. And you
Hmm.
just literally amplify forces. Ever since I met you and you introduced me to, I think, 4 or 5 other people on very similar paths as me, it's like we're always connecting and we're always thinking similarly. And somehow you just figured that out. You said these people will get along, and that was an amazing skill that you have.
Thank you. I've said that. Some doctors have said that connecting people is my superpower, and I have no idea how that happened, but it is true. It's like when I talk to a doctor, I have an idea of who they'd like to be connected with. So, but thank you. So by way of introducing you a little more formally from your tagline on LinkedIn, Hardeep is a cancer doctor, scientist, pilot, truth seeker, force and voice multiplier, educator, speaker, and travel blogger. Those are just some of the things. You're a lot of things.
Yeah, I wrote that thinking what reflects me, and I'm those different roles at different times and different portions of my life. It's important to realize we're all those things. We're not just one static force. And LinkedIn used to be just like a connection for work to find jobs, like almost like a
Hmm.
resume builder or a job seeking place. And it's becoming now a community for conversation and sharing ideas. I absolutely love it. It's social media, but it's in a different way, I think, a different sort of intent, way more responsible, way less clickbait. And I mean,
Hmm.
although there are advertisements and videos, I just feel like it's more authentic and more people talking about important things in their fields, which I love.
Yeah, I agree with you, and I've only been active on it just coming up on a year now.
Oh my
But
gosh, in a year you've like grown tremendously. I'm just looking at your profile right now. It's amazing how many followers and people you've
yeah,
connected
well,
with.
it's funny. Yeah, well, when I
Wow.
first joined, because I've connected you with Dr. Michael Hirsch, right?
Yep, that's right.
One of the people. So he was my first, well, LinkedIn, I had less than 150 connections a year ago and I was never on it. And so he clicked connect and it snowballed. And now I'm connected with like 5,000 doctors, I think. So it's a lot of fun. I meet so many kind, interesting people doing interesting things. I love it. So today we'll be talking about, well, possibly a range of topics, everything from oncology and cancer journeys to physician and trainee journeys, to aviation, to the importance of human touch in medicine. We'll see where the conversation goes. So as we get
Absolutely.
started, what would you most like our audience to know about you?
I mean, I think basically I'm an oncologist, and the biggest thing I focus on is journeys and the fact that everyone's on one, whether you have cancer or don't have cancer, you're probably affected with someone or you know someone who has cancer. And this is something we talk about in my clinic a lot, and the fact that every journey is a marathon, it's not a sprint. There's the journey of finding out what's going on, and then the treatment phase, and then, as you've seen in your own personal life, the survivorship phase as well. And they're all have different challenges. And the point of saying all that is that realizing that one day I do believe cancer will either be cured or just be a manageable illness, just like diabetes or hypertension. You can't get rid of diabetes, but you can treat it for a long time. So I'm starting to see that more and more in my field. Many cancers, especially things that are detected early, it
Mhm.
becomes a journey, a marathon, not a sprint. And so I think that's so critical. I always talk about empowering journeys and talking to people about um, having support systems, but also being kind to yourself, being present and realizing it's not your fault, realizing that we're going to support you.
Mhm.
And so it's just a real privilege to be on such an amazing journey with people, real life people who, are often hidden behind an illness. An illness sometimes defines people, and then they realize, there's a person behind that illness. And when you empower that soul to reclaim control of their own lives, that's really what brings me the most joy. And that's where I connect with people on a very personal, vulnerable level. I mean, it's a privilege that not many people get to do. I'm just very humbled by it every day.
Well, thank you very much for your work because, as you know, I've had cancer 3 times recently, and I have a medical oncologist, and I think the world of him, and I'm grateful for all of you. Did you want to share at all how you came to choose this specialty?
Certainly. I mean, I grew up with my mom being a nurse, an oncology nurse at the VA hospital in Arizona. So I would go in junior high and high school. I would go most summers, almost the entire summer, volunteering at the VA hospital.
Hmm.
So absolutely love veterans and the mission of the VA hospitals, and the fact that it's also kind of separated from the usual, like insurances and private
Hmm.
corporations, just like a government-run entity that works in its own little niche. But absolutely learned so much. And in my training too, from college to medical school to residency, even afterwards, before COVID, even I stuck around at the VA and just did a few shifts at the emergency room
Hmm.
because I loved it so much. I loved the colleagues, I loved the patients, the people. Um, so in many ways, how did I become an oncologist? It's because my mom was an oncology nurse, and
Hmm.
over time, I've just been lucky to have training opportunities, which just kind of confirmed that's what I was meant to do. And I did go off, by the way, on trying other things, but I realized someone once told me your skills and passion lie in internal medicine, and oncology, of course, takes even more than that. Takes a little bit of
Hmm.
compassion, empathy, um, and these are things I had, but there was a challenge. It was hard, and I like that. I like to challenge the norm, always be a lifelong learner, and just never settle for status quo. And that's what you have to do in oncology. Literally, it changes every year.
Hmm. Yeah, right, for sure. I know, just keeping up with the literature and everything, right? The studies
Hmm.
and
Hmm.
everything is yeah, that's, and I think patients never think about that at all. The other
Yeah,
things, right? Some of the things that are involved behind the scenes.
absolutely.
Yeah, yeah. Well, I know you had shared a funny, touching story with me. I didn't know if you wanted to share that here. I really liked it.
Absolutely. I mean, I think we were talking about St. Patrick's Day recently, and when you messaged me, that just came into my mind, a funny story. I mean, it's not a funny story, it's a touching story, but has
Yeah,
funny elements to it.
yeah.
Um, and basically, in holidays, especially in a cancer clinic, they become a big deal. It doesn't matter if it's Valentine's or St.
Mhm,
Patrick's Day, certainly Christmas. People get emotional about it, because you think about I think memories come up. You're like, when I was celebrating this a year ago, my mom was alive, or I was
right.
doing this in college when this holiday came around. And it's St. Patrick's Day, in many ways it's more of you could say, a fun holiday. But we had a patient who was um, Irish, Scottish, you could say UK background, and St. Patrick's Day was a big part of his life. And he had head and neck cancer. And so not being able to have a pint on that day,
Mhm,
especially since he was on chemotherapy and could not really eat or drink because he had head and neck cancer. So he was being fed through a G tube, like a tube fed into his stomach
mhm,
for about 8 weeks. A very
mhm,
long time. We take it for granted that we're eating and drinking and swallowing all the
right.
time. And when you have cancer of that area, you can't necessarily do that. And so it's not like we brought him into clinic and gave him a beer and said, "Oh, it's
Mhm.
okay, St. Patrick's Day."
Right.
That would have burned. And I told him, "Don't do that." But what
Right.
I did um, I knew he loved Guinness, so I bought a Guinness mug and I filled it with these kind of like lozenges. They were like candies, lozenges
Yeah.
that promote saliva production and just help heal the throat and the mouth. And
Mhm.
I knew he was taking lozenges that he didn't really like the taste of. So I think I
Mhm.
got they weren't beer flavored. I think they were like Guinness flavored or very hot,
Oh
deep
my goodness.
dark chocolate flavored. And so
Okay.
I filled a mug with them and we all dressed up for St. Patrick's Day. I think I was like a leprechaun. I had like a hat on and the rest of the staff dressed up, of course, with beads. And when he came into the office, and by the way, this was not an office visit. He didn't have a visit that day. He just said,
Oh.
I'm lonely. I feel awful today. And we're like, why don't you come in? We're celebrating St. Patrick's Day. Why don't you come in? We'll have some fun. And came in, we took pictures together, I put on some beads on him, and uh, and he couldn't eat any of the food or anything, and he didn't,
Yeah.
you know, it was just a nice gesture. Like we're celebrating
Mm.
together, giving him control of his life again. And what's funny is just 2 days ago, that patient texted me again. He's going to um, Rome and going on a food tour. So, he's gone through this journey and survived. But
Right.
what's amazing is when you asked me that question and I brought up the story with you, literally that story somehow manifested itself by him texting me, like
Mm.
literally a day after that. And so I always say, like, the universe is all connected. When you think of things and people, they're thinking of you as well. And we
Right.
have this tremendous quantum connection with each other that you don't have to be geographically in the same room, but you can feel it and it's real
Mhm.
and it's quite amazing.
Yeah, I agree with you, and I've had similar instances. It feels like over the last few years. So yeah, that's really special. Oh, I love that, and that's great that he's eating and drinking again, and he's heading to
Yeah,
Europe. So
back
good
to
for
normal,
him.
completely back to normal.
Yeah, well, that's great, and thank you for the role that you play. In saving people's lives and keeping us alive. We wouldn't get very far without doctors. That's for sure.
Well, thank you, Kim.
And so also I know you wanted to talk a little about doctor journeys and what trainees have to endure from start to finish, including like proving and reproving themselves and
Mhm.
match day, like any of that. What would you like to speak to?
Certainly. I mean, match day just happened a week or so ago, and I always speak on behalf of my school at the Cleveland Clinic, and what an amazing that school is 20 years old as of this summer. I mean, it's a 20th anniversary coming up, but it was an experiment and we didn't know if it would work. And I was the third class in. I didn't even know if I would match.
Hmm.
And it's strange, many people don't realize this, that the amount of time doctors spend second guessing themselves, having imposter syndrome, is
Mhm.
because of how many times we've had to reprove ourselves. I mean, my journey started in
Mm.
junior high and, going every summer, volunteering 40, 50 hours a week instead of getting a job or, um,
Right.
I was big into sports and I kind of sacrificed that. I shouldn't have, honestly, looking back.
Mhm.
But my point being that we sacrifice opportunity, time, so
Mhm.
much to devote to not just learning, but to get into these positions, to get into a good school, let's say, to study hard and get good grades, to do well on standardized exams. And there's a lot of weed out processes in all of this. There's either really hard classes or tests like the MCAT or the SAT, which could make or break someone. Someone who's extremely smart who doesn't take tests well
Right.
is toast. And
Mm.
then beyond that, you could have the greatest scores in the world. If you don't interview
Mhm.
well or talk well with
Mhm.
people, you're also toast. My first series of interviews when I tried to do in high school, trying to get into a Ivy League college, I did not succeed. And looking back, I know why I
Mhm.
didn't. I was very immature, and all the stuff I said, it
Mm.
wasn't like this. It wasn't digested. It wasn't mature. It
Mm.
was just sort of, I worked at the VA. I did this many hours. You should take me.
Okay.
It's nothing to do with anything.
Mhm.
So time and maturity, experience is what's built. And that's why I tell every training doctor, it's not just about your training and scores. Do human things, do things outside the beaten path. For me, that was not just doing research and going abroad to Poland for a semester during college, but also getting a pilot's license, which I always wanted to do. I love aviation.
Mm.
Um, as soon as that happened, I just became a different person, I feel, even though
Mhm.
literally I haven't flown more than, let's say, 150 hours in my lifetime in a
Mm.
private plane, but the perspective it provides, the things you talk about with people, whether it's patients or interviewers, is amazing.
Mhm.
But going back to my earlier point, people don't realize that after all that, high school, college, getting into med school, surviving med school, passing several medical school exams and standardized tests, and even doing interviews again now for residency, where you start your training program and possibly more residencies and fellowships. But just imagine a doctor in that phase, you would say, oh my gosh, they've made it. And yet,
Mhm.
if you were to look at those training doctors on the day before match day, every single one of them thought, I'm not going to make it. I'm not going to get what I want.
Mhm.
I'm not good enough.
Mhm.
This is too hard. The competition's too stiff. Everyone's good.
Mhm.
Isn't that amazing? No one thinks of your doctor like that, oh my gosh,
Right.
these extremely smart people who are
Mhm.
kind,
Yeah.
smart,
Right.
competitive,
Right.
on paper feel like they're inadequate. And the rest of their lives, sometimes, even in careers, trying to get jobs, trying to get promotions, sometimes feel inadequate, like we're doing something wrong. And so it's an incredible responsibility
Mhm.
and the oath that you take towards medicine. But it comes with that burden, I feel. And I use burden in a very positive sense. It's a responsibility to do the best you can for your patients, to be the best version of yourselves, and then to empower the next generation that comes after you to keeping that knowledge train alive. It's not just about you. You can impact
Mhm.
the world more if you empower others on their journeys.
Yeah, no, right. I understand everything you're saying, and I thought it is a really good point about that imposter syndrome can come from having to prove and reprove yourself over and over again. Because doctors have been talking about imposter syndrome, but everyone might not be sure like how it starts.
Hmm.
And I thought that was a really good point. Hmm.
It's rampant in our field. I think it's rampant in many fields, to be quite honest. And it's
Hmm.
part of it's, mindfulness, emotional intelligence, learning to be present and not too hard on yourself. But it's a natural human reaction, to be honest. Anyone who wants to strive for greatness, to help others, at some point in your life, you're going to think to yourself, I'm not good enough, or because you can't save everyone, right? Life is unfair, things happen. And so,
Hmm.
um, when you realize that you're not in control and whatever happens is the way it's meant to be, is the way to conquer imposter syndrome, because you realize this is the journey, this is the way it's supposed to unfold. And if it didn't unfold exactly this way, I wouldn't be who I am. And if that, for example, for me, I would never be meeting you today if that didn't happen in a certain way. And it was a
Hmm.
struggle many times, times when failure, happened. And you could say it's failure, but experience is what you get when you don't get what you wanted. And if you reflect on that and be genuine and authentic, I don't think there is truly any failure. There are just many parallel journeys, and the one you
Mhm.
land on is the one you're meant to be on.
Right, right. And Michael Hirsch, who, has been coaching me for the last year. And I know he would say, an obstacle, what that just means is like, nope, you're not meant to go that way. It's basically a
Hmm.
sign
Hmm.
pointing you in another direction, even though you might be frustrated and think, this is what I wanted to do. This is how I wanted to do it. I failed. He's like, no, it's great. It just means you're supposed to go in another direction.
That's correct.
Yeah. Well, that's great. Well, another thing that we talked a little about actually, because you shared a post on the human touch in medicine, and that
Hmm.
really resonated with me. I was wondering if you'd like to speak a little to that.
Absolutely. Going back to training in medical school, we learn all these esoteric exam tools, how to use reflex hammers and use a stethoscope to listen to every silent heartbeat or sound in the lungs, and neurological exams to know every cranial nerve, what it's doing at any moment. And it's amazing how proficient we get, but in real life practice, you have literally no time to do such an exam. So you do a focused exam and sometimes even I get into the mindset that, okay, someone just had, let's say a CT scan. I already know what's happening inside your body. Or you had an
Mhm.
echocardiogram. I already know how your heart is beating because somebody did an ultrasound of it. Way
Mhm.
better than my stethoscope could ever do, right?
Mhm.
Um, but that article that you read, even kind of renovated my ideas of what exam is about. It's not about just reporting objective findings and going through the motions. It's actually therapeutic. People think about it. People want to be touched, reassured. Some people hug me after each visit, some don't. You know, everyone's different. But in general, human touch is healing. Like
Mhm.
touch is what it's all about. And so I've tried to use that in my practice more. Doesn't mean I do a full, thorough neurological exam. I don't really need to most of the time,
Mhm.
but definitely recognize that there's opportunities to give therapy in other ways that are not just medicine, like drugs or
Mhm.
objective knowledge. It's really the human connection, and you know, humans exist. That's a important thing in our social structure is that touch element. Otherwise, you know, for example, during COVID, when we all did Zoom calls like this, why didn't we not like them? And why don't
Mhm.
people like to work from home? Because you miss that interaction, right?
Mhm.
And that face-to-face interaction is critical. So I'm trying to rejuvenate that in my practice. I'm not perfect because I'm running behind, and I'm like, okay,
Mhm.
I don't have time to listen to their lungs because they have no lung symptoms to report.
Mhm.
But I can do something else, maybe just to show them I care. And that's really what it's about, to show that you're present, you know.
Yeah, no, that's beautiful. And as physical therapist, I think it's safe to say that I never had a visit with a patient in over 30 years where I didn't touch them. But actually, because I know some people who have seen physical therapists in this day and age that don't. Like their therapist will
Hmm.
just be giving them exercises or, putting them on equipment and stuff like that. And literally, a couple people have told me that they saw a physical therapist that did not touch them. And I almost couldn't believe it.
Wow.
But,
Yeah,
and
I
I
feel like
know.
it's a dying art, and it's not just going through the motions, it's observation, it's being present in that um, sphere. It's like a personal boundary in space, and patients make themselves very vulnerable when they share that
Mhm.
sphere with you. And I'm not saying take advantage of that vulnerability or that personal space. I'm saying when they let you in, what they're wanting is like a personal touch, a connection. And so when you see an opportunity like that, use it to connect with someone that connects with people more than words or
Mhm.
objective testing and finding sometimes.
Yeah, absolutely. And amidst my health challenges, I ended up with Lyme disease and a concussion, and I had neck issues and dizziness. So I went to a physical therapist. Actually, I ended up having a couple because my insurance changed. And I appreciated physical therapists so much more after I went to a physical therapist myself because it's like, like they did. They had their hands on my, you're laying back, and it's like they're just touching you and trying to
Hmm.
help you and heal you. And it really meant a lot.
Absolutely.
Yeah, yeah. So, so is there any tips that you have in general for your colleagues, like from seasoned physicians to medical students or even those considering med school?
Sure. You know, for trainees, that's easy for me because I just tell them experiences, what I've been through and their journey. I reassure them. You know, a lot of it's just preparing yourself for the marathon, knowing it's a battle in a way. It's like you have to prepare yourself to give up a lot of things, but know at the other end that it's worth it. There's times during my journey where I said, "What am I doing? This is too hard. Why did I commit to this?" Um, you're going to have moments like that, but you're coming into a wonderful profession. You know, too often on LinkedIn, especially, for example, we talk about the negative parts of medicine and, you know, burnout and artificial intelligence and too many electronic medical record tasks to do, insurance companies. You know, we talk about the negative, and there is stuff that can be improved. But there's so much positive, it overwhelms it all. Why do we all do it? It's because of the positive. But I tell students, you know, and trainees from any level, whether it's literally a day away from starting your first job to literally starting your high school and about to prepare to get into college and everything in between, it's also a journey there. And that journey is so important, and you must empower it with a wide variety of experiences. Do things that connect with people. You don't have to do medical things. You don't have to be in a hospital starting at age 12 to become a
Mhm.
doctor. You shouldn't,
Right,
in fact.
right.
Go play sports, learn the power of teamwork and failure. You know, learn how to fail. It's going to happen.
Mhm.
Learn how to take it gracefully and learn from it. And talk to people, talk to strangers, talk to random people and learn from them. One of the best things about the VA is in a way, I had a captive audience. I would sit with patients during their 4-hour chemo sessions, and I was their entertainment and they were mine.
Mhm.
And we just stared at each other, and there was no
Mhm.
cell phone or any distraction. We talked for
Right.
hours. That probably had more to do with my development than reading a
Mhm.
textbook. Um, and same with learning things from people from different walks of life, whether it's friends or other colleagues. You can learn so much from people who approach problems differently. Um, and as far as current doctors, I mean, I think it's when you speak shop together, if you were to see me and my colleagues speaking shop, a lot of it's venting, a lot of it's commiserating together. It's that collegiality of complaining together, and that's good actually. That's healthy. You need to
Right.
do that.
Sure.
But I would say to the physicians, in your sphere, wherever you are, you don't have to be a big wig or be the leader of a big institute to have a difference. Whatever your sphere is, whether it's just your office, your patients, the doctors around you, um, that voice is huge. And the community empowerment and advocacy one can do in just that sphere. If everyone did that in America and in the world, again, you talk about force amplification. With one
Mhm.
person, there's only so much you can do, but thousands and hundreds of thousands of people linked together with the same purpose, just
Mhm.
making an impact on their community, whatever that is, whatever the size is, it doesn't matter.
Mhm.
That I feel will create a unified voice. Because I do still feel physicians don't have a unified voice. I mean, we're not unionized.
Mhm.
Um, in the government, yeah, we have some lobbyists, but we're pretty much over lobbied by other interest groups most of the time. Um, so we don't stand up for each other enough. And yeah, people make some great LinkedIn posts and write some amazing things. But at some point, I don't know when it'll happen. I do feel doctors as a group will stand up and just
Mhm.
say, stop this nonsense. And I saw a wonderful post recently that basically said, um, patients and doctors unite. Together, you can actually fix the holes in the system. And I thought, what a great way to do it. Your client, the patient, and the
Mhm.
physician, one of the most sacred relationships that
Mhm.
exists, use all of those patients you've ever touched in their lives and helped, and then all the doctors throughout the world and their patients. That would be the best force for change, trying to figure out what we can do better.
Mhm.
Because I do think the status quo is not really serving anyone well, and I don't know why we do it. We go through the motions. Even I do it.
Mhm.
And there, there's low-hanging fruit and there's things we should fix and there's things that are probably too difficult to fix right away. But we should start on that journey, and I think we're capable.
Yeah, I agree with you. And medicine forward. That's what
Yeah.
we're trying to do, right? Restore the sacredness in the doctor-patient relationship, and just to try to be a network of networks, and then just myself trying to raise awareness about all of these issues. So I hope that the tide is turning and ripples of change, as Dr. Todd Aden would say.
Absolutely. And what you're doing is amazing. Not everyone is like you, a patient who goes out like you are on social media, but also doing podcasts like this with doctors, people you never met, amplifying voices and connecting them. I mean, imagine if every patient was like you. I mean, we would solve so much so quickly.
Mhm.
So you can even empower your patient, your fellow colleagues, friends, and patients to do the same. Again, on any level, it doesn't have to be all on podcasts or LinkedIn. Whatever we can do together, I think we're far better than doing alone.
Yeah, you're right. And I've been trying to find some local patient collaborators. That's been going a little bit slowly. So that's what I was going to ask you. And I guess you've already spoken to it, is if you had advice for patients who want to support their doctors.
I think you do what you're doing. You talk to your physician about life and how things are going and support them in any way possible. Sometimes support doesn't have to be a big march and be holding up signs and going to
Hmm.
Washington D.C. It doesn't have to be on that level. I have patients who just drop by and bring a gift or just want to say hi. I mean, that patient I brought up earlier who celebrated St. Patrick's Day with us. You could say I arranged that for the patient, but quite honestly, I benefited way more from it than I think he did because
Hmm.
it was just an amazing
Yeah.
experience to celebrate that
Mhm.
together. So I think um, to see patients happy and empowered makes us empowered, and to see them giving back, whatever that means. It doesn't have to be giving back to me personally or to a health
Mhm.
system. to even see them amplifying whatever they wanted to do in their lives and succeeding at it,
Mm-hmm.
that's a victory, and that makes us
Right.
tremendously empowered and makes us feel we did good for the world.
Yeah, right, right. Well, thank you. Well, that was beautiful. Was there anything else you wanted to add as we wind our conversation down?
I think we've talked about a lot of great themes. I mean, I know you wanted to talk about aviation briefly. I don't know if we have time on this
Yeah, we
podcast.
do.
We could talk about some of that. I mean, a lot of people ask me that. That's probably the first thing people ask me. Oh, so you're a pilot. And what most people don't realize is I was a pilot. I haven't flown in a long time because life got too busy. And the biggest thing a pilot will tell you, especially flying small planes, is the hardest decision to make is when not to fly, when
Mm-hmm.
to not go up in the air. And of course, there's so many reasons to not go up, including weather, let's say, or
Mm-hmm.
um, stress and other things. But too
Mm-hmm.
often there's this syndrome in pilots. They even named it. It's called get-there-itis.
Oh,
Get-there-itis. It's this idea that no matter what, you got to go in that plane, get where you need to go, and no matter what, at all costs, because that's what you got to do. And
mm,
unlike an automobile where you walk in, turn it on, and drive, if something goes wrong, you could stop on the side of the road. You could go
right.
get a mechanic. You can if your engine shuts off, whatever happens,
Mm-hmm.
you're not going to be crash landing a car usually.
Right.
It's
Mm-hmm.
so too often amateur pilots or even professional pilots who um, have this get there itis, this idea that they have to go someplace and get there, especially people who, let's say, use aviation to commute from a job. Doctors could be classical examples in certain settings. Um, that's where people get most accident prone. They make decisions that are not based on fact because
Mm-hmm.
they're treating it like an automobile. They're treating it like a standard commute on a train, and it's never a standard commute. There's so many things you have to do in an airplane to keep track
Mm-hmm.
of what's going on around you in 3 dimensions. Um, uh, with traffic around you, with terrain, with weather, with your fuel, your speed. Um, Literally so many things to keep track of, and it's joyful, to be quite honest. I can't find any more joy than being in that focused cockpit environment. To me, it brings great joy. But if you're in a stressful environment, let's just say you had a rough day and you're still mulling over it, or emotionally stressed for any number of reasons, and you get
Mm-hmm.
into an airplane, that logic and peace that you once had is now replaced by panic, especially if
Mm-hmm.
the world closes in around you. And you add in a couple elements like weather or disorientation for even a second. Um, we've seen even in San Diego a couple years ago, a pilot flying back from clinic in Yuma, Arizona, a trip he'd done multiple times, literally just nosedived into the ground. And it was all disorientation, and who knows what other factors were involved in his life that day. But it's sad, and
Right.
so I always say, ever since I started my formal training, it just got too busy. 80-hour work weeks. Then I had my firstborn in the intern year, first year of training, where I'm working the
Right.
hardest.
Wow. Wow.
Had my first baby, and so you quickly realize it's not worth the risk. And
Right.
even though I tell people aviation and flying is the safest form of travel, when you do it incorrectly or you take risks and you're not fully there, and you're doing it like as a commute or something that's
Mhm.
routine, it's never routine. Just remember that. You
Right.
always you
Right.
always have to
Yeah.
be, I mean, I remember having a flight instructor who would just tell me, this is silly, but every 10 minutes, tell yourself, what if the engine shut down right now? Where would I crash land? Always be looking
Okay.
for a landing spot.
Okay.
That's silly. Why should you be looking for a landing spot? You're in the clouds in the air, soaring amongst the
Mhm.
birds. Why should you be looking for a landing spot? Because you have to be in that mindset. If this happens, do this.
Mhm.
Don't panic. Um, you know, we talk about stalling airplanes, or people just kind of pull back on the yoke and keep the airplane in the air. That stalls the airplane. And what you're supposed to do if the engine shuts off is establish a best glide speed and immediately look for a landing spot and then
Mhm.
communicate and do things in a certain order, including with checklists. And if we had more time, we would talk about checklists and how important they are in medicine. Because I use checklists that I borrowed from my aviation world in my practice. Because I think it's good quality. It helps you think and go through systems in a process.
Right. And
And so we talk about doing things in order and not panicking and establishing the best glide speed so you can have the longest time to try to figure out the problem, but knowing that if you don't figure it out in the air, you're not going to wait last minute and crash somewhere. You're going to already have it planned out where you're going. And so this idea that always be thinking of that, I mean, it's always stuck with me. Not that I'm always thinking of backup plans and this and that, but think,
Mhm.
you could fail, you could
Mhm.
crash land. What would you do if? Um, it's a good thing to have. It's somewhat healthy as long as it's not like paralyzing. Um,
Right. Right,
so,
right. Well, and thank you, because even that's like a metaphor for life, right? Like, look where you
hmm,
can land and communicate and all those things you said. If people rewind this, if they're watching, and put in life, and insert that instead of airplane, and there's a lot of
yeah.
wisdom in there. So, so how can our listeners get in touch with you?
Oh, certainly. I mean, feel free to connect with me on LinkedIn, Hardeep Phull, Phull. Um, and I'm on Instagram and Facebook as well, but most people don't connect there. On Instagram, I'm Hardeep MD. I think Twitter, I'm Hardeep MD. But my biggest thing is LinkedIn. And I use a lot of Instagram to make videos, but I often post them on LinkedIn. I like the idea of sharing and commenting and creating dialogues. On a lot of social media, you're just kind of liking and scrolling. It's fun. I do like doing it. In fact, most of my travel posts and things with my family, I put on other social media. But, as far as professional stuff, I think LinkedIn is a great place to connect. That's how we connected.
Exactly. Yeah, me too. So we'll see y'all on LinkedIn. So thanks again for being my guest today, Hardeep. I loved having our conversation. I knew I would.
I loved having this as well. And thank you so much for arranging this. Happy to do it again.
Okay, excellent. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
I love that. Thank you, Kim.
Thank you, Hardy.